Hi, my name is Dr. Delia Garcia, and I am creating this short video to specifically talk to burned out health professionals. I was one of them. So I am a physician. My background is that of oncology. My specialty was breast cancer, and I did that for 30 years. I loved it. I loved every minute. I know I did a lot of good, but there came a time where I just needed to do something else. The electronic medical record was becoming mandatory, and I sat for two trainings of EMR, and I just was terrified of how that was going to change me as a physician and how that was going to change my practice. Going into a room and working off a laptop instead of looking a patient in the eye and doing it the old way. So I decided to jump off the cliff. Um, I decided to leave mainstream medicine. I did that 10 years ago, and I cried like a baby for about a week. It was a huge chapter to close. It was very emotional. I was terrified of whether or not I would be able to create income going forward, whether I would be able to continue supporting my children. I had one son in college, I had two in high school, in private schools, and I was the breadwinner. So I was really afraid, but I wasn't afraid enough to not do it. I knew there was a better life out there, and I was going to create it for myself. So how did I create it for myself? Well, while I was practicing medicine, I was looking for a tool to help my patients get to a healthier weight because there's a huge link between overweight and breast cancer. And I was tired of seeing younger and younger women come into my practice, most of them overweight and stressed out and eating the wrong things and not engaged in healthy lifestyle. So I made that part of my practice, and I'd been doing that for about 5 years before I jumped off the cliff and left mainstream medicine. So I had a tool. The tool was health coaching, and I was set to make it work as a second career. Touch a lot of people, get a lot of people healthy, start to work on the other side of the fence instead of going into a room and telling a 35-year-old about her bone or brain metastases. I was going to be able to talk to people about how they could stay out of a physician's office. So I jumped into it with both feet. It's a structured program, all about diet and lifestyle. The lifestyle piece is huge. Weekly coaching, educational materials, a Facebook support group, a weekly webinar to help our patients learn healthy lifestyle. So all of these pieces that are in place that can help people be successful, creating that better life that they're looking for. And and what I love about the particular coaching program that I've been affiliated with for the past 15 years is that it's under the auspices of a publicly traded company. So they do all the heavy lifting. All I have to do, and all that other physicians that have embraced this health coaching model have to do, is find the people that are looking for us. They're out there, they're on their knees at night praying for someone to come and rescue them. So we know that obesity is a huge problem in our country. And this health coaching tool is a way to help people get to that healthier weight reduce or eliminate medications, and even reverse medical conditions such as diabetes and hypertension. We don't make any claims, but come on, we know that if people lose 50 or 30 or 100 or 200 pounds, they're no longer going to be a type 2 diabetic about 83% of the time. They're no longer going to have hypertension. So I'm just um, so gratified and so grateful, I should say, so grateful that I have a new career that has given me balance in my life. Because before, I was like other health professionals, rushing to work in the morning, staying late, rushing home to try to spend some quality time with my children, and there was never enough time. And now, this is a part-time business that can create more than a full-time income, and we can do it from anywhere with a laptop, with a cell phone, and with internet access. What I love is working with individuals and families to help them live their best life, but I also love working with health professionals, locking arms with them, mentoring them, modeling for them this program and this business so that they can create the life that I've been able to create for themselves. And I want to share one slide with you. And this is a slide of my life now. So I work from home. Gosh, there's nothing better than that. I work from home. I work from home. I work from home. It's amazing. Um, I am able to travel. I can do my business from anywhere. Um, and I love traveling. Before, I would go on a trip and I would spend most of my time um, agonizing about what I left behind and then worrying about all the work that I needed to do when I got home. Who can identify with that? Most of you probably can. I have so many friends now. When I was crazy busy working as a physician, I didn't have any friends. Um, my friends were, my children and my former husband. I and now I can entertain, have people over, go out with, make new friends, go out with people and enjoy the evening, enjoy the weekend. It's just so different than the life that I was living before. I have time to enjoy my young adult children. They're in their 30s. I have a daughter and two sons. When my mother was in the final years of her life, she spent months on end at my house, and I was able to care for her because I worked from home. So I could get her breakfast and lunch and take her out to dinner and to movies and just spend time with her. You can't put a price tag on that. I have time to exercise every single day. I love yoga. I do cardiovascular on my off days from yoga. And again, it's just a completely different life. I have pets, two cats. I love my pets. They follow me around everywhere. And before, I barely paid attention to them. So you too can create that life of your dreams, the life that, you've had to give up and that you thought was no longer possible because of the career that you chose. And I'd love to share that with you. If this video is being shared by someone other than myself, reach out to the person that shared this with you. Because again, you don't have to live the way that you're living. I mean, some healthcare professionals are loving their careers. Maybe they're new and they're not in that 20 or 30 or 40-year hiatus that I was in, where I did feel burned out and I was feeling a little resentful that I didn't have time to enjoy life like other people. So now I have that, and I'd love to be able to help other health professionals do the same. We've got a simple system that works, and I mentor people and lock arms with them and model everything for them. So please reach out to me if you'd like to learn more, or reach out to the person that shared this video with you.